Emory Healthcare is offering new advice on how to stop the spread of coronavirus as Georgia braces for its peak, which is coming up in the next few weeks. Here is 11 Alive investigator Andy Parati with things that you can do right now.
We're going to show you how to make a mask.
I made a video on how to make a mask.
So our first approach is super easy. We'll be using a square scarf.
And what we're going to do is hemming those outside edges at about a ½ inch hem.
Number 1, face masks. We're all about to see a lot more of these on the faces of your friends and neighbors. And Dr. Mary Beth Sexton, an infectious disease expert at Emory University, says that's a good thing.
If everybody wears these cloth masks out in public, then nobody is exhaling these infected respiratory droplets and everybody is protected.
The CDC recently issued new guidance to encourage people to wear masks, but Sexton says the public should be making their own, not buying medical grade ones, which hospitals desperately need.
This is a really important distinction. These are not medical masks like surgical masks, procedure masks, or the N95s. What the cloth masks do is if you're wearing one, it makes sure that you don't cough, sneeze, these infectious viral particles. So you wearing one keeps other people safe. And if everyone wears one, that protects you too.
Number 2, stop wearing gloves. COVID-19 is a respiratory virus. It's not something you can catch through your skin.
Gloves seem to give people a false sense of security because their hands are protected. So they don't realize that they've then touched everything around them with those same gloves. So people end up contaminating sometimes a lot more surfaces wearing gloves than without them.
Bottom line, just wash your hands. And number 3, outdoor social distancing. Sure, going to parks and walks outside is acceptable, but avoid busy trails like the Beltline and cross the street if you see someone coming your way.
When you're outside, you're very much helped by all of the airflow, but it's still really important to maintain that distance from people.
Dr. Sexton's final piece of advice: if you have food delivered, it's unnecessary to wipe down all of your groceries. Simply unpack the food and wash your hands after and before eating.
Thanks a lot, Andy.